So let's talk about the Power of Cannabinoids Part 2, CBD, CBDa, and CBDv. Now, a few housekeeping issues on this particular webinar. First of all, you'll find a Q&A button that's at the bottom of your screen. Please feel free to use it to ask questions during the webinar. And as you know, prior to the webinar, you submitted some questions, and what we'll do is we'll answer those questions at the end of this particular video. Also, as a follow-up, you'll be getting an email from us that'll give you a link to our YouTube channel, which has a link to the recording of this particular video. You'll also get slides in flipbook format. You'll get sponsor discounts, speaker information, and other information about our topics. Now, please feel free to go to Marijuana Aware to check out our resources about past webinars, and also our YouTube channel, YouTube at Marijuana Aware, for Q&A sessions, this video, and other webinar videos, and also bonus videos that you'll find that are out there. So let's talk about cannabinoids and how they're produced. And specifically, when we talk about CBD, CBDgA produces CBDa, which then morphs into CBDv, and when it's heated, produces CBD and CBDv. And this is how the plant actually is produced, and it's a morphing process in the cannabis plant. Now, what is CBDa? CBDa converts into CBD through the decarboxylation process, and that's the process of applying heat to the particular product. CBDa is a non-psychoactive cannabinoid found in raw cannabis and hemp. It interacts with the CB1, CB2, serotonin, and TRPV1 receptors. TRPV1 is a receptor for pain and also for your body temperature. What's its potential effects? What's an anti-inflammatory, neuroprotective capability, appetite suppressant, and antioxidant? It also is known to ease the gastrointestinal discomfort problems such as IBS symptoms, evidence of anti-exagitatory and antidepressant effects, works with serotonin signaling to influence mood regulation and stress response, and may also help with nausea. Now, what is CBDv, or cannabindivirin? CBDv binds to the TRPV1 receptor, which again regulates the body temperature and pain. It's non-psychoactive, found in cannabis and also in hemp, and it interacts with the CB1, GRP55, and TRPV1 receptors, as well as the serotonin receptors, and has a neurochemical pathway that gives it anti-epileptic and anticonvulsant properties. That's a nice way of saying it has a tremendous amount of medical benefits, which include an anti-epileptic, anti-inflammatory, neuroprotective capability, helps with metabolism and appetite regulation, anti-seizure, anti-nausea, and anti-anxiety. It also may help with the recovery of a lot of memory defects, helps to curb the symptoms of OCD, potentially helpful in the treatment of neurological hyperextensibility, supports neurological health and brain function, and also can help to promote mood stability. So let's talk about CBD. Again, CBD is found in both hemp and also in marijuana. It's a cannabinoid that binds to the CB1 and CB2 receptors, and it's called what they call an inverse agonist, and that means it only lightly binds to these receptors. And that may be why CBD blocks a lot of the psychoactive effects of THC. A little bit of CBD will take you down from that high that you're getting from THC itself. It's a great regulator. Now, what are its potential effects? It's an analgesic, anti-inflammatory, anti-seizure, anti-anxiety, and anti-tumor capability. It significantly improves multiple sclerosis spasticity. Also, it helps to treat opioid addiction, helps with the improvement of insulin sensitivity in type 2 diabetes, can help to manage ALS symptoms, and may also help with the symptoms of Alzheimer's, Parkinson's, multiple sclerosis, and schizophrenia. One of the nice things about CBD is that it reacts not only to the receptors, the CB1 and the CB2 receptors, again, CB1 receptors in our immune system and peripheral organs, CB2 for inflammation and immune system response, but it also works with a number of other receptors. The 5-HT serotonin receptors helps with digestion, blood flow, and breathing. The A2A receptors for inflammation and coronary circulation. Again, we mentioned the VR1 receptor, which is for pain and also for body temperature, and the GPR55 receptor, which helps for blood pressure. Now, when it comes to purchasing CBD products, you'll find it comes in 3 different packaging types. One is a full spectrum product, the second is broad spectrum, and the third is isolate. So what does that mean? If you take a look at an isolate product, it contains all CBD. If you take a look at a broad spectrum product, it contains not only CBD, but also the terpenes, cannabinoids, and flavonoids that are associated with the hemp or the marijuana plant. A full spectrum product not only has the CBD, terpenes, cannabinoids, and flavonoids, but has just a little bit of THC in it, 0.3% THC or less by definition. What What THC does is it boosts the medical efficacy of CBD, and very important. I suggest that if you're looking for a CBD product, look at a full spectrum product unless you're extremely sensitive to THC itself. So let's summarize. You'll notice that CBDa, CBD, and CBDv all have anti-inflammatory capability. This is one of the most famous reasons for using CBD products. You'll also notice that CBDa and CBDv also have neuroprotectant and anti-nausea capabilities. You'll also notice that CBD and CBDv also have anti-seizure and anti-anxiety capabilities. One of the nice parts about the CBD family of products is they address a very wide range of medical conditions from IBS, MS, Alzheimer's, help with opioid addiction, can help curb OCD, and also help in brain support and mood support. How do you know you have a CBD product? Well, this is what the certificate of analysis is about. And I chose this particular COA because it's a distillate cartridge. A lot of people ask, can I get CBD in a smokable form? And the answer is absolutely. In this particular case, this is a cartridge. It's called Harlequin from the Air dispensaries, and it's a distillate cartridge that's considered a sativa, meaning it's energetic. It has 42% CBD, 40% THC, and you'll notice it also has CBDv in it. This is 0.7%, which is kind of interesting. CBDv is not in large quantities, but it is very potent when it is available. It has a great terpene profile. It has the beta-caryophyllines, alpha-pinene, caryophyllines, limonene, beta-pinene, and a number of other terpenes that are quite effective.